Hey everyone, welcome back to Study Acupuncture with me. In this episode, we're going to go over the Yin Wei Mai and the 3 clinical applications of the Yin Wei Mai. Now, those 3 clinical applications are, number 1, it nourishes blood and yin. Number 2, it treats mental, emotional issues. And then number 3, it treats a very specific type of headache. So first, with the Yin Wei Mai, we know it's one of the extraordinary vessels. And it's not only called the Yin Wei Mai, it's also called the Yin Linking Vessel. And it's called the Yin Linking Vessel because it's a vessel that links all of the yin channels. And you might recall from my extraordinary vessel episode where I talked about the extraordinary vessels and their functions, and it actually functions as a reservoir, meaning they can take excesses from the main channels and they can redistribute that excess when the body calls for it. In fact, I'll link that episode in the description of this episode. Now, back to the Yin Wei Mai. The Yin Wei Mai, as with all the extraordinary vessels, we have opening points and we have coupled points. So the Yin Wei Mai, the opening point of the Yin Wei Mai is pericardium 6, and the coupled point is spleen 4. Now, the Yin Wei Mai, it also has a Shi cleft point. That Shi cleft point is kidney 9. Alright, next let's take a look at the pathway of the Yin Wei Mai. So here we have a diagram of the entire pathway. So as you can see, the Yin Wei Mai, it starts on our body at kidney 9. Now, kidney 9 is actually the Shi cleft point of the Yin Wei Mai, which we know with Shi cleft points, they are also known as accumulation points. And it's called an accumulation point because it's an area of the body where Qi and blood is going to accumulate. It's basically a specific area where Qi and blood is going to gather, and it's going to gather deeply in this area. So that's why it's called an accumulation point. And because Qi and blood gathers here, or it accumulates here, you can use that Shi cleft point to treat 2 things. You can use it to treat acute conditions, which an acute condition is any condition that's in the acute phase. Now, this is the early stage of a condition, meaning it just started not too long ago. And kidney 9 is actually where the pathway of the Yin Wei Mai starts. So from kidney 9, the pathway is going to go up the inside of your lower leg. It's going to go up the inner side of your thigh until it gets to spleen 13. Now, from spleen 13, the Yin Wei Mai is going to go up and share more spleen points. So it's going to share spleen 15 and spleen 16. Now, after spleen 16, the Yin Wei Mai is going to go and connect with a liver point. It's going to connect with liver 14. Now, liver 14 is the front mu point of the liver channel, and it's located forsun, lateral to the midline, in the 6th intercostal space. Now, from liver 14, the Yin Wei Mai is going to go up across the chest, and it's going to go to the throat. Now, here's where the Yin Wei Mai is going to connect with the Ren Mai, and it's going to end here at this pathway where there's 2 Ren Mai points, Ren 22 and Ren 23. So with the Yin Wei Mai, there's only 7 points. There's kidney 9, spleen 13, 15, and 16, liver 14, and then there's 2 Ren points. There's Ren 22 and Ren 23. Now let's talk about the 3 clinical applications of the Yin Wei Mai. So with the Yin Wei Mai, there's 3 general clinical applications. Number 1, we have nourish blood and nourish yin. And we said before how overall the Yin Wei Mai, it connects all of the yin channels together. So that means it connects the kidney, the spleen, the liver, the lung, the heart, and the pericardium. So we can use the opening point and the coupled point, which is PC6 and spleen 4, to activate the Yin Wei Mai to use it for its first clinical application, which is to nourish blood and nourish yin. Number 2 clinical application is that the Yin Wei Mai can be used to treat mental emotional issues. And this one actually has a lot to do with clinical application number 1, which is that the Yin Wei Mai can be used to nourish blood and nourish yin. And this is because blood is the residence of the mind. And because Yin Wei Mai connects all those yin channels and it nourishes blood and yin, you can use the Yin Wei Mai to affect blood and yin boosting organs, like for example the spleen. The spleen produces blood, and the heart governs blood. So if your patient's presenting with any mental emotional issues, like for example depression, anxiety, mania, these all can actually stem from blood related roots. Like for example, if there's heat in the blood or if there's blood deficiency, both of those pathologies would cause the mind to lose its residence in the blood. It would cause it to lose its house, and that's why you have those mental emotional issues. And now the last clinical application for the Yin Wei Mai is that it can be used to treat a specific type of headache. It can be used to treat deficiency-type headaches, like for example blood deficiency-type headaches. So what's an example of a deficiency-type headache? For example, a Yin headache. A Yin headache can be because of blood deficiency. Now, how do you know that it's a blood deficiency root? Well, you would base it on the patient's presentation. So what are you going to find? You're going to find blood deficiency manifestations. Like for example, when you look at their tongue, what kind of tongue might you find? So you might find a pale tongue that's slightly dry. That's a blood deficiency type tongue. Now, the thing with a pale tongue is that you have to be very careful because a pale tongue can either be blood deficiency or it could be yang deficiency. The difference is going to be in the moisture of the tongue. So if the tongue, for example, is slightly dry, then that's blood deficiency. But if the tongue is slightly wet, then that's how you know it's yang deficiency. So on one hand, blood deficiency, one hand, yang deficiency. Slightly dry, slightly wet. Now, another thing with blood deficiency headaches is that the pain that the patient's going to report is going to be different. It's not going to be pounding. It's not going to be stabbing. They're going to say that they have a dull headache. That's an empty type headache. That's a deficiency type headache. And the Yin Wei Mai can be used to treat these types of deficiency headaches. All right, now lastly, let's go over the clinical manifestations related to a pathology in the Yin Wei Mai. Now, the main thing that you need to know for the board exam is that if there's a pathology in the Yin Wei Mai, your patient can present with three things. Your patient can present with chest pain, cardiac pain, and sometimes even stomach ache. Now, this is actually referenced from CAM. Now, if you look at Machocha, there's a lengthy list of manifestations there. I've actually included those manifestations in the study guide that's part of this episode. If you want study guides directly into your email, make sure you're signed up for my email list. If you're signed up for my email list, you get study guides with each theory-based episode. And you can actually sign up to receive my study guides on a monthly basis at www.studyacuwithme.com. All right, now back to Machocha. Even though Machocha has a lengthier list, we can superimpose our knowledge of the pathway of the Yin Wei Mai, and we can actually see these manifestations make more sense to us with that knowledge. So here we have the diagram again for the pathway of the Yin Wei Mai, and you can see the Yin Wei Mai covers from kidney 9 and it goes up to spleen 13, 15, and 16, and then it goes to liver 14, and it goes over the chest, then it goes to Ren 22 and Ren 23. So with the first set of manifestations that we have, they're all chest related manifestations, and the Yin Wei Mai we see from the pathway that goes over the chest from liver 14 to Ren 22 and Ren 23. So we get the pain in the heart area. We get the fullness of the chest. We get the pain in the chest, even pain in the hypochondrium. We get a knot in the chest. We also have here dry throat. That's the Ren 22, Ren 23 area. We also have mental emotional symptoms here too. So we have anxiety, we have insomnia, we have pensiveness, we have these obsessive thoughts. Now, these manifestations, they actually have to do directly with knowledge from the classic text. So here on the screen, I have a quote from the Classic of Difficulties, which basically says that if there's disease in the Yin Wei Mai, then there could be heart pain, depression, pensiveness, loss of willpower, loss of self-control, and a lot of other mental emotional issues. All right, so that does it for this episode of Study Acupuncture with me. Until next time, God bless and happy studying. Oh hey, you're still here. Well, while you're here, let me tell you about today's sponsor. So today's sponsor is Poo Tea. Poo Tea is a hot and cold pain relief oil product, and right now you can get all of their products for 50% off. Just use code SAWM at pootee.com. That's POUTEE.com.